A counterintuitive reality regarding daily hygiene practices warrants attention. While bathing is widely perceived as an activity for cleanliness, vitality, and muscle relaxation, for individuals aged 70 and above, this routine can inadvertently become a significant hazard within their own homes. This assertion is not intended to incite fear, but is grounded in sobering statistics and medical findings. In Japan, a nation sharing similar hot bathing customs and climate with Vietnam, medical studies reveal that the number of elderly individuals involved in bathroom accidents surpasses those in traffic accidents. Alarmingly, 90% of these incidents involve individuals over 65 years old. Crucially, most of these unfortunate events are not attributed to slips, falls, or drowning as commonly assumed, but rather to sudden cardiac arrest or extreme blood pressure fluctuations occurring upon entering or exiting a bath. Why does a simple act from youth become a medical risk in old age?
Our bodies, akin to machines that have operated for 70 years, possess temperature and blood pressure regulating sensors, medically known as baroreceptors, which lose their sensitivity with age. Exposure to hot water causes rapid vasodilation, forcing the heart to work harder to compensate. Conversely, stepping out into cold air leads to abrupt vasoconstriction. This rapid and dramatic shift results in erratic blood pressure fluctuations, imposing immense strain on the heart and brain. Therefore, experiencing dizziness, lightheadedness, or rapid heartbeats after bathing should not be dismissed as mere refreshment. These are critical distress signals from the body. Even slight oversight or complacency in maintaining old habits can turn each bath into a gamble with one's health. We will now address 5 common yet hazardous habits. The first and most prevalent dangerous habit is bathing in excessively hot water. While many, particularly in colder weather or when fatigued, prefer very hot water, believing it promotes detoxification and muscle relaxation, scientific evidence indicates the opposite for individuals over 70. Excessively hot water does not detoxify. It induces thermal shock, placing immense stress on the heart and blood vessels.
To illustrate, our vascular system functions like a network of pipes. In youth, these pipes are elastic and responsive. With age, blood vessels become stiffer and less flexible. When hot water, such as above 42 degrees Celsius, is applied, the initial physiological response is maximal dilation of subcutaneous blood vessels to dissipate heat. This causes a rapid redistribution of a significant volume of blood from internal organs and the brain to the skin. Consequently, blood pressure can plummet sharply. The aging heart, ideally needing rest, is then forced to rapidly pump blood to compensate and ensure adequate cerebral perfusion, leading to symptoms like rapid heartbeat and palpitations, often mistaken for improved circulation. The danger intensifies upon exiting the bath or turning off the shower. Transitioning from a hot vasodilated state to the cooler bathroom air immediately triggers sudden vasoconstriction. Blood previously concentrated at the skin is forcefully driven back into the core, causing a swift and dramatic spike in blood pressure within seconds. Imagine blood pressure surging and dropping like a roller coaster. The cerebral blood vessels are ill-equipped to withstand such rapid changes. Medical research, particularly from Japanese experts studying a population prone to hot tub bathing, confirms that this extreme blood pressure volatility is a primary cause of dizziness, syncope, and more critically, myocardial infarction or stroke within the bathroom environment. For individuals with pre-existing conditions like hypertension, hyperlipidemia, or heart disease, bathing in overly hot water poses a severe challenge to cardiac endurance.
Therefore, it is strongly advised to avoid excessively hot water. Lukewarm water, approximately 38 degrees Celsius, slightly above body temperature and comfortable to the touch, is sufficient. Do not wait for steam or prolong immersion for perspiration. The safety of your heart far outweighs the momentary sensation of intense heat. The second hazardous habit, deceptively perceived as hygienic, is vigorous scrubbing. Many individuals, including seniors, habitually use thick washcloths, abrasive loofahs, or even scrubbing stones and salts. The belief is that thorough scrubbing until the skin turns red ensures cleanliness and unclogs pores. However, for skin at age 70, this practice is detrimental. Aged skin is not as resilient or oily as youthful skin. It is delicate, akin to tissue paper. The natural protective oil layer on the skin's surface is significantly diminished. What is often perceived as dirt and vigorously scrubbed away may in fact be the last fragile protective barrier shielding the body. Applying strong force during scrubbing not only removes dirt, but inadvertently destroys this natural shield. Dermatological studies on the elderly indicate that even moderate friction can reduce the skin's protective capacity by nearly half. The consequence is the appearance of thousands of microscopic abrasions, often invisible to the naked eye. These tiny breaches become open gateways for bacterial entry. At this age, the skin's immune response is compromised and wound healing is slower. A small scratch from scrubbing can lead to dermatitis, severe itching, and potentially soft tissue infections requiring prolonged and costly antibiotic treatment and hospitalization. Cases of seniors complaining of persistent itching, cracking, or even ulceration despite diligent washing often trace back to rough bathing tools.
Thus, it is recommended to immediately replace abrasive bathing implements. Discard stiff loofahs and overly thick washcloths. Instead, use a soft cotton towel, or ideally, your bare hands to gently cleanse the skin. Bathing is for cleaning dirt, not for stripping the skin. Treat your skin with the care and gentleness reserved for a valuable antique. The third hazardous habit, widely prevalent, is bathing immediately after a full meal. While the notion of cooling down after eating or cleansing before resting may seem logical in terms of timing, physiologically it presents a significant risk for the elderly. Consider the body as a nation and blood flow as its security forces. After a full meal, the body's system mobilizes a substantial amount of blood, estimated by scientists to be around 26% more to the stomach for digestion. The stomach becomes a high-activity site, demanding extensive blood supply. If, at this critical juncture, one bathes in warm water, the peripheral vasodilation caused by the warmth diverts blood to the skin for heat dissipation, as previously discussed. This creates a physiological tug-of-war. The stomach demands blood for digestion, and the skin demands blood for thermoregulation. The crucial orchestrator, the brain, is then temporarily deprived of adequate blood supply. In medicine, this phenomenon is termed postprandial hypotension, post-meal drop in blood pressure. While younger individuals with healthy vasculature can rapidly compensate for this deficit, for those over 70 whose blood pressure regulation is slower, insufficient blood flow to the brain can lead to sudden dizziness and lightheadedness. Imagine experiencing sudden darkness, weakness in limbs, and a momentary loss of balance in a slippery bathroom. Even a slight stumble can result in a fall, which for the elderly can have catastrophic consequences, ranging from soft tissue injuries to hip fractures. A hip fracture can lead to permanent immobility.
Therefore, the golden rule is to consider a meal as a no-bathing sign. After eating, allow at least 1 hour for rest and digestion. Let the stomach complete its work. Bathing later is safer for your brain and physical stability. The fourth dangerous habit, often postponed until the end of the day, is bathing late at night, typically around 9 or 10 p.m. Many believe that cleansing after a day's accumulated grime promotes better and deeper sleep. While logical for hygiene, from a cardiovascular chronobiological perspective, this is a potentially costly error. The human body operates on a natural biological clock. During the day, activity is high. As night falls, especially after 9 p.m., the body transitions into a resting mode.
heart rate naturally slows and blood pressure gradually decreases to allow organs to relax in preparation for sleep. However, bathing, particularly with hot water, during this crucial period forces the heart into sudden overdrive. Hot water raises body temperature, stimulates senses, and accelerates heart rate. Subsequently, stepping out into cooler air causes blood vessels to constrict. This disruption interferes with the natural nocturnal blood pressure rhythm. Advanced cardiovascular research warns of a hazardous phenomenon known as nocturnal hypertension or reverse hypertension, where instead of declining during sleep, blood pressure remains elevated or even rises due to late-night bathing. The most alarming aspect is that these incidents often do not occur during the bath itself, but insidiously manifest during deep sleep. A cardiac arrhythmia or an acute hypertensive crisis occurring in the early morning hours, unnoticed while sleeping, represents an unacceptable risk.
Consequently, it is advised to adjust bathing times. The optimal period for bathing is during daylight hours, or at the latest in the early evening, around 6 or 7 p.m. Endeavor to complete bathing before dinner, or at least 1 to 2 hours before bedtime. This allows the body sufficient time to gradually cool down and for heart rate to stabilize before sleep. A restful sleep must be a safe sleep, originating from a calm heart undisturbed by late bathing. The fifth and final hazardous habit on this critical list is not an action, but rather the cold, enclosed, and slippery bathroom environment itself. In Vietnamese residential architecture, bathrooms are often tiled for cleanliness. While cool in summer, during winter or cold spells, stepping into a bathroom can feel like entering an ice cellar. To counteract the cold, there's a tendency to tightly close doors and block all ventilation. This inadvertently traps oneself in a dangerous environment. Firstly, there is the triple thermal shock. Imagine moving from a warm bedroom, undressing, and stepping into a frigid bathroom, causing the body to instantly constrict. Then, hot water is applied. Finally, after bathing, the water is turned off and the wet body is once again exposed to bone-chilling cold. 3 consecutive rapid temperature changes are an overwhelming stressor for the elderly nervous system, leading to severe blood pressure fluctuations and susceptibility to dizziness and fainting immediately after turning off the water.
Secondly, there is the risk of hypoxia. Bathing with hot water in a tightly enclosed room generates dense steam, displacing air and significantly reducing oxygen levels. While this may not affect young, healthy lungs, for individuals over 70, even a slight oxygen deficiency can cause the heart to race and lead to lightheadedness, potentially resulting in fainting. Most critically, the most perilous trap is the slippery floor. Even a minimal amount of soap or water on tiled floors can transform the bathroom into an ice rink. For seniors whose balance is often impaired and bones are brittle, a single slip in the bathroom frequently leads to the most catastrophic outcome, a hip fracture, specifically a fractured femoral neck. It is imperative to emphasize that a hip fracture at age 70 is not merely painful, it is often termed a fateful fall. Medical data indicates that 50% of elderly individuals who sustain a hip fracture never regain their normal walking ability, and tragically, approximately 25% experience severe long-term complications or mortality within the year following the injury.
1 in 4 individuals will not survive past the first year due to complications stemming from prolonged bed rest, such as pneumonia or pressure ulcers. Therefore, it is imperative to promptly address the inherent risks within the bathroom environment. Avoid excessively cold bathrooms by activating a heat lamp or running hot water to warm the space before disrobing. Ensure adequate ventilation by leaving a slight door ajar or utilizing a vent to facilitate oxygen circulation. Crucially, equip the bathroom with anti-slip footwear or rubber mats on the floor. Investing in these seemingly minor items is vital for safeguarding both mobility and life. We will now delve into the most critical aspects for individuals with pre-existing medical conditions. While the aforementioned 5 habits pose general risks, the bathroom demands heightened vigilance for the following 4 groups.
Please listen carefully to identify if you belong to any of these categories. First, individuals with high blood pressure and heart disease. Many individuals accustomed to soaking in hot water to lower blood pressure. While warm water benefits blood vessels in the long term, the immediate danger lies in the instantaneous effect. Recent cardiovascular research indicates that upon entering a hot bath exceeding 40 degrees Celsius, the heart must significantly increase its pumping rate. For a weakened heart or hardened arteries, this sudden acceleration is akin to demanding a sprinting effort from someone merely walking, leading to cardiac overload. I must emphasize a critically important point. Absolutely do not bathe immediately after taking blood pressure medication. When the medication is actively dilating blood vessels, combined with the vasodilation caused by hot water, your blood pressure could plummet to dangerously low levels, causing immediate fainting. Please wait at least 30 minutes after taking medication before bathing.
Second, individuals with diabetes. This group is particularly susceptible to preventable accidents. Why? Because diabetic neuropathy often leads to a loss of sensation in the hands and feet. You might perceive the water as merely warm, when in reality it could be scalding hot at 50, 60 degrees Celsius without your awareness. By the time skin blisters or deep burns occur, it is often too late. As you know, for diabetics, a burn or ulcer on the extremities is extremely difficult to heal, carrying a very high risk of infection and necrosis. Therefore, a vital principle for diabetics is never to rely on the sensation in your hands or feet. Purchase a water thermometer, or more simply, use your elbow, a region with thinner and more sensitive skin, to test the water. If your elbow feels a burning sensation, immediately add cold water. Third, individuals prone to vertigo, dizziness, or those with a history of fainting. For this group, the bathroom is the most common place for falls. Rising hot steam combined with an enclosed space reduces oxygen supply to the brain, which can easily trigger a dizzy spell. My specific advice is to forego standing showers. Immediately acquire a sturdy plastic shower chair. Sitting while bathing will improve your balance significantly. Should a dizzy spell unfortunately occur, being seated is considerably safer than standing precariously on a slippery floor. Remember never to bathe on an empty stomach or when feeling fatigued.
Finally, individuals over 75 years old. Even without serious underlying conditions, the body's thermoregulation mechanism changes completely after the age of 75. Scientists have demonstrated that individuals over 75 absorb heat nearly twice as fast as younger people, but their ability to dissipate heat through sweating is significantly diminished. This means you are highly susceptible to internal heat shock without realizing it. Therefore, for those over 75, I offer sincere advice. Do not attempt to bathe your entire body daily. Daily full-body bathing is unnecessary and can even be harmful, leading to dry skin and heat loss. It is sufficient to wipe down important areas and take a full bath 2 to 3 times a week. Understanding your body to adjust your habits is the wisest way to live healthily. To alleviate anxiety, I will now share a golden formula, a remarkably easy-to-remember scientific solution for completely safe bathing, eliminating the need for constant worry and calculations each time you enter the bathroom. I present to you an extremely memorable safeguard, the 3-3-3 formula. This formula is derived from recommendations by the U.S. Centers for Disease Control and Prevention and the World Health Organization. By simply remembering these 3 numbers, you can transform bathing from a potential hazard into an entirely safe practice.
The first 3. Bathe 3 times a week. I understand many individuals are meticulous and feel uncomfortable if they don't bathe daily. However, modern dermatological science confirms that for older adults, daily bathing is not a requirement and can even be detrimental. The reason is that older skin produces very little natural oil. This invaluable oil helps retain moisture and prevents bacteria. If you scrub daily with soap and hot water, you inadvertently strip away this protective layer, leaving skin dry, cracked, and more prone to infection. Reputable health organizations like the CDC recommend that for older adults, a full body bath 2 to 3 times a week is sufficient for hygiene. On other days, simply perform partial bathing, using a warm cloth to thoroughly cleanse important areas such as armpits, groin, and feet. This method ensures cleanliness while preserving your skin's vitality and integrity. The second 3, water temperature of 38 degrees Celsius. This is the golden number for your heart. Why 38 degrees and not 40 or 42 degrees? Japanese researchers conducted extensive experiments and discovered that water at 40 degrees Celsius or above begins to stimulate the sympathetic nervous system, causing the heart to beat faster and blood pressure to fluctuate. However, at 38 degrees Celsius, the water is only 1 degree warmer than our body temperature. This neutral temperature is sufficient to warm the body, but is incredibly gentle, causing no shock to blood vessels or heart rate. What does 38 degrees feel like? It is a warm, comfortable sensation, not scalding, and crucially without excessive steam. To be certain, it is best to acquire a water thermometer for your bath or use your elbow to test as previously instructed.
The third 3 minutes of golden moisturizing. Many people bathe, dry themselves, get dressed, and then leisurely apply moisturizer, or even forget entirely. However, Japanese studies have revealed a surprising truth. If you apply moisturizer within 3 minutes of exiting the water, your skin's ability to retain moisture reaches its maximum. At this point, pores are open and the skin is saturated with water. The moisturizer acts as a seal, locking that moisture inside. Conversely, if you wait 90 minutes or longer to apply, the water will have entirely evaporated, rendering the cream almost ineffective. By simply remembering this 3-minute rule, you can reduce the risk of chapped, cracked, and infected skin by nearly 50%. Therefore, keep your moisturizer in the bathroom, on the vanity shelf, so it's readily accessible immediately after bathing.
In addition to the 3-3-3 formula, I wish to add a small note regarding duration. Each bath should only last about 7 to 10 minutes. Avoid prolonged soaking, as it does not enhance cleanliness, but rather dehydrates the skin further and increases the burden on the heart. The next section is particularly important to me, and I wish to dedicate special attention to those living alone or whose children are away at work all day. Living independently is a source of pride, but in the bathroom, independence can sometimes be a double-edged sword. Statistics do not lie. Individuals living alone face a nearly 5-fold higher risk of life-threatening incidents compared to those living with family. Why? Not because they are weaker, but because when an incident occurs, there is no one present to provide timely assistance during the critical golden hour. Therefore, I establish 5 vital rules. These are not mere suggestions. They are medical imperatives that I urge you to engrave in your memory. Rule number 1, absolutely never lock the bathroom door. I know this habit is difficult to break due to privacy concerns, but consider this. If you should become dizzy or fall inside, that locked door becomes the greatest barrier separating you from help. If the door is locked, rescue teams or family members will require 15 to 30 minutes to force entry. In medical emergency, we call this a fatal delay. If the heart stops or the brain is deprived of oxygen, we only have about 4 to 5 minutes for intervention. Those 15 minutes to break down a door could cost us our entire chance of recovery. So please, only close the door. Or, if you must lock it, use a type that can be easily opened from the outside with a coin or a spare key kept nearby. Do not turn your bathroom into an impenetrable fortress.
Rule number 2. Your phone must always be within reach. Nearly 80% of older adults do not bring their phones into the bathroom for fear of water damage. However, if you fall, a phone left in the living room, no matter how advanced, becomes useless. Purchase a transparent, waterproof Ziploc bag for your phone. Or more simply, place your phone on a low shelf near the floor or on the toilet tank where you can reach it even if you are lying on the floor. Set up speed dial for your children or emergency services. A single button press can completely change the outcome. Do not let yourself lie there in pain, conscious but helpless, unable to call for help. Rule number 3. Report before bathing. This may seem slightly inconvenient, but it is a remote guardian rule. Before bathing, text or call your children, or even a close neighbor. I'm going to bathe. I'll text you in about 20 minutes when I'm done. Instruct them that if they don't receive a text in 30 minutes, they should call you immediately. If you don't answer, they should come over at once. This small action creates a safety net. It ensures that if something happens, you will be discovered within 30 minutes, rather than lying there for 6 or 12 hours waiting for someone to notice your absence.
Rule number 4. Equip handholds. Never fully trust your footing on a wet tile floor. Immediately install sturdy stainless steel grab bars in strategic locations, near the toilet for getting up and sitting down, and at the entrance and exit of the shower area. And most importantly, as I mentioned earlier, acquire a specialized shower chair, a plastic chair with wide legs and non-slip rubber feet. Sitting while bathing reduces the risk of falling by up to 70% compared to standing. When seated, you will never lose balance, and it is the most effective and inexpensive way to protect your hips. Rule number 5. The Stop Immediately Rule. This is an emergency response protocol. Our bodies are incredibly clever. Before fainting or having a stroke, they often send warning signals about 10 to 30 seconds in advance. If you are bathing and suddenly feel dizzy, lightheaded, your heart is pounding, your hands and feet are trembling, or you feel nauseous, immediately squat or sit down on the floor. Do not try to reach for a towel, turn off the water, get dressed, or step out. Attempting to stand up or move at this moment will cause blood pressure to drop more rapidly and lead to a severe fall. Sit flat on the floor or lie on your side. This posture helps blood flow to the brain most easily and prevents injuries from a high fall. Then, use the phone you kept within low reach, according to rule number 2, to call a loved one.
These 5 rules may sound serious, but they are truly a lifeline. Being well prepared is not being overly cautious. It is a profound respect for your own life and a source of peace of mind for your children. We have just completed a crucial journey, revisiting even the most minor daily bathing habits. Perhaps many hearing this will dismiss it, saying, "Oh, I've bathed this way my entire life and nothing has happened." But please understand, nothing has happened yet does not mean nothing will ever happen. A 70-year-old body is fundamentally different from a 20-year-old body. A car that has run for 50 years requires different maintenance than a new car. Please remember today's core message. Vietnamese people do not bathe too little. We bathe incorrectly. For older adults, each incorrect bath is a gamble with our health. Therefore, I earnestly urge you to engrave the 3-3-3 formula into your mind. Simply bathe 3 times a week, ensure the water is only 38 degrees Celsius, and remember to apply moisturizer within 3 minutes after bathing. Do not try to scrub vigorously, do not bathe in excessively hot water, and absolutely do not lock the bathroom door when you are alone. These changes are minor and cost nothing, yet they form a robust shield protecting you from strokes and avoidable falls and fractures. Healthy aging is not about achieving extraordinary feats. Healthy aging is about knowing how to adapt, how to humbly listen to your body, and how to prevent risks in your daily life. We maintain our health not only to avoid pain ourselves, but also to allow our children to work with peace of mind, ensuring our golden years are filled with joy and tranquility, not a burden of medication and illness.
If you found today's sharing helpful, please take a moment to like and share this video with your elderly friends and loved ones. Who knows, your one share today might help someone prevent an unfortunate accident tomorrow. And don't forget to subscribe to the Kweveza channel right now so we can meet again in future videos with the most practical and enjoyable medical knowledge. Before I say goodbye, I want to ask you a question. Among the 5 dangerous habits I just described, which one do you most often fall into? Or do you have any other personal tips for safe bathing? Please leave your comments below so I and everyone else can learn from them. I wish you always peace, clarity, and abundant health.